Mr. Deputy Speaker, for my budget debate speech today, I would first like to speak on certain issues relating to the support for our seniors, followed by the issue of support for adults with disabilities, and finally, like in my previous year's budget debate speech, I will continue with the issue of green transition. Mr. Deputy Speaker, DPM and Finance Minister Lawrence Wong said in his budget speech that preventive care is especially important for seniors, that loneliness can do great harm to a senior. They need to stay active and socially connected. Hence, the government will set aside $3.5 billion to start the 𝐁𝐿 for the next decade. There are several components to this, and one component is that there will be an expanded network of active aging centres, or AACs, providing a wider range of programs. Mr. Deputy Speaker, as always, the devil is in the details, and I look forward to hearing more details from the ministers in charge on the changes in plans of AACs, but in the meantime, I have several comments and questions. First, I would like to ask MOH, what is the current situation with the staffing as well as the recruitment efforts for our AACs? How will MOH assist our AACs to recruit and maintain additional staff to tackle the manpower needs for a bigger scale AAC landscape? Does the government have a guideline in mind for the manpower staffing per centre under AAC 2.0? Of course, taking into consideration the requirements for clusters may vary according to the size of the cluster. AACs have a mix of staff and volunteers. While staff strength of AACs may vary from centre to centre, and volunteers are also an integral part of AACs, volunteers may not always be able to take over the roles, expertise, and indeed professionalism of the professionals in our AACs. Next, for the group of seniors who do not wish to be involved in their AACs activities or do not desire to keep in contact with their AACs, I would like to know what are the plans that 𝐁𝐿 may have for them as far as outreach and keeping in contact are concerned. This will be in line with tackling loneliness and addressing the need for seniors to be socially connected, as mentioned by DPM Wong. I'm especially concerned with those who live alone, keep to themselves, and who are not close to their families or neighbours. Beyond having more or more varied activities, we need to study what approach can be taken to better enable AACs to keep in regular contact with this group, at least to provide support when it is needed. Studies should also be done to see how AACs can attract better male participation. DPM Wong also mentioned in his speech of silver upgrades to our residential estates to enable seniors to live more independently and safely in the community by way of amenities such as therapeutic gardens and barrier-free ramps and senior-friendly home fittings such as wider toilet entrances and shower seats. I look forward to more details from the government, including how these amenities will be made available to residents in their homes and in our common spaces. DPM Wong also mentioned that there will be improvements to infrastructure for seniors' mobility and safety, such as more sheltered linkways, bus stops with senior-friendly features, as well as safer and more pedestrian-friendly roads. I welcome these. As recently as August 2022, in an answer to a parliamentary question, the then Minister for Transport said that there were no plans to expand the criteria of LTA's existing covered linkway program, covering a 400-metre radius of major transport nodes, such as MRT, LRT station, and bus interchanges. I hope that there is now a rethink about this approach for covered linkway, especially on lands administered by LTA or other state lands. LTA should consider linking at least the heavily utilized bus stops to nearby housing estates. For example, working with town councils to link up such heavily utilized bus stops with the nearest covered walkways within the HDB estates. Still relating to seniors, the budget will give all Singaporeans born in 1973 or earlier a MediSave bonus of $750 and double this at $1,500 if they are part of the modular generation and their residence has an annual value of not more than $25,000. For seniors with especially multiple chronic illnesses and frequent medical appointments, this MediSave top-up will not help much as long as the annual MediSave withdrawal limit remains at $700 a year for patients with chronic illnesses. Can the government look at increasing the cap for the MediSave withdrawal unit for seniors with multiple chronic conditions so that such seniors, especially seniors who are retired and not working or are unable to work, will be less out of pocket when paying their bills? I note that the Medisave withdrawal limit was revised in January 2021. Would it now be timely for the limit to be raised, at the very least, to keep up with elevated inflation? Given that the quarterly quantum of Silver Support Scheme will now be raised by 20%, can the government consider raising Medisave withdrawal limits from, say, $500 to $600 and from $700 to $840 for chronic cases as well? And that those suffering from multiple illnesses to be granted further extension of the caps on a case-by-case basis. Mr. Speaker, in Mandarin, please. 副总理兼财政部长王群才在预算案强调，政府会加强对乐龄人士的支持。我希望相关的部长能分享更多的细节。王副总理提到，通过邻里银发设施的翻新和提升，以让年长者能够在社区中更加独立和安全的生活。这包括扩展有盖走道、具有年长者友好功能的巴士车站等等。在2022年8月，当时的交通部长曾表示，路交局没有扩展现有的有盖走道的计划。目前，路交局的有盖走道路线限制于地铁巴士总站的400米内。我希望政府能重新考虑这个策略，特别是在路交局或国有土地管理的地皮，例如路交局可以考虑和市政会合作，将竹屋邻里有盖人行道连接到比较繁忙的巴士车站。此外，预算案也包括了为符合条件的国人提供一次性保健储蓄花红，数额由年龄和住家的房屋年制计算而定于750块或1500块。对于患有多种慢性疾病而需时常去门诊的乐龄人士，尤其是那些已退休了或无法工作的乐龄人士，如果每年提款顶线还定在700块的话，这次的填补可能不能给予太大的帮助。提款顶线上一次是在2021年1月进行修订，在这物价高涨的时候，为了减少退休人士的现金支出，政府是否会考虑调高保健储蓄提款顶线？乐龄补贴计划即将进一步提升20%，政府是否能考虑也把保健储蓄提款顶线的这个数额同样提升20%。In English, Mr. Deputy Speaker, I will next touch on the issue of support for adults with disabilities. I welcome DPM Wong's announcement that he will provide more support for adults with disabilities. He said he will expand spaces in sheltered workshops and day activity centers where they can undergo skills training and launch more enabling services hubs to provide community support to persons with disabilities and their caregivers. I believe that as a society, there's a lot more we can and should do for adults with disabilities among us, in particular adults with serious special needs, as well as their caregivers. Earlier this month, I filed a PQ asking whether the MSF would consider increasing the number of day activity centers and residential homes for adult persons with autism. Minister Masagos replied that there are currently 8 day activity centers serving adults with autism spectrum disorder, with over 300 clients enrolled in these day activity centers and about 80 referrals pending enrollment. He also said that there are 4 adult disability homes funded by MSF serving adults with autism spectrum disorder. There are about 50 residents with autism spectrum disorder in these adult disability homes, which have capacity house about 100 residents. About 20 referrers are pending enrollment. Mr. Deputy Speaker, I believe that there's such a need to increase our day activity centers and residential homes. I believe that we really should increase our resources to provide continuous training for adults with disabilities, including but not limited to special needs adults, such as those with moderate to severe autism. beyond their time in the SPEC schools. In my view, there are multiple possible benefits. We should continue to think of ways to improve long-term post-SPEC school education or training, providing further education and skills training if possible. More studies should be done to increase the possible range of work training these adults can undergo and the range of work they can undertake in society. This will enhance their lives and promote better integration with society. At the same time, spending time at day activity centers rather than at home with structured programs, activities, and interaction with others will enhance the mental well-being of such adults. My heart also goes out to senior caregivers and their special needs adult children, wondering what is going to happen to the care of their children when their health gives way one day. Even when these parents may have other children who are non-special needs, is it appropriate to expect them to take over care of their siblings when their parents pass on? Should we not provide adequate residential homes for these adults with more structured care and development? And can we also consider for these homes to allow some of the special needs adults to be able to go home to their families on weekends, providing some balance between residential care and home care, allowing family members suitable respite in the process? Minister Masagos also said that MSF have been working with the sector to develop plans to better support adults with autism and their families. Given the increase in awareness of autism and in the clarity of its diagnostic criteria, and the MSF will share more details in the coming months. Indeed, I hope MSF is able to share such details during COS, including details of any studies undertaken recently. In November last year, I filed a PQ asking the Minister, among other things, whether the Ministry keeps a record of the current number of elderly caregivers who are caring for adult persons with intellectual disabilities, and whether the Ministry will consider developing and implementing early identification and support programs for such caregivers. SMS Tan Kit Hao mentioned in his reply that MSF does not directly track the number of elderly caregivers who are caring for adults with intellectual disabilities. In December 2023, news broke that one of my Hougang residents, an adult with special needs, stayed in his flat with the body of his elderly father after his passing for 5 days, while continuing to attend day sessions at his daycare center. While I'm extremely thankful that the authorities and stakeholders were commendably quick to assist and arrange for care for the son thereafter, this case reinforces the need for us to consider developing and implementing an early identification and support program for elderly caregivers who are caring for adults with special needs. Such a program could adopt a multi-agency approach that involves our AACs, daycare centers for adults with disabilities, healthcare providers, and even service providers like lawyers who may have interactions with family members in the course of their related work, for example, doing LPA, as well as stakeholder agencies like AIC and MSF, such that each party can trigger another party to provide necessary checks or support for the family in concern. Studies should be done to see how contact and support can be appropriately maintained by one or more stakeholders for both elderly caregivers as well as the special needs adults. Last year, I said in my budget debate speech that we should work towards AACs which cater to different needs of seniors, whether social or medical, or for more specialist areas like mental health, disabled persons who are seniors. The centers should still be referring centers, even if other organizations or subunits are involved. Indeed, an expanded AAC can also perform the coordinator or contact role for elderly caregivers of adults with disabilities. Mr. Deputy Speaker, let me now move on to ongoing efforts for green transition. Last year, I said in my budget debate speech that we need a detailed roadmap for retraining workers in these sectors as Singapore decarbonizes. And I asked whether we have sufficient sustainability-related courses that businesses and workers can afford to attend, both in terms of time and money. In my speech today, I will go on to talk about the quality of the education to be provided. Mr. Deputy Speaker, capacity building is a core concept of development. In the context of climate change and sustainable development, upskilling is now necessary to ensure a just transition and that no worker is left behind. Singapore has been investing heavily in lifelong learning and upskilling since SkillsFuture was launched back in 2015. Government spending has shifted towards adult education and training to accelerate the nation's green transitions. Institutes of higher learning form the backbone of this shift, and there exists a multitude of courses available to build capacity and upskill the existing workforce in areas such as ESG and carbon services and trading. However, growing our talent pipeline must also include investing in primary, secondary, and tertiary education. I'm pleased to hear of a new Master of Science in Climate Change and Sustainability program at NUS. The MSc program in Data Science for Sustainability was also launched in NUS to train data scientists who can integrate their knowledge and skills with an understanding of sustainability issues. NTU has a Nation School of the Environment and offers majors in environmental, earth system science, public policy, and even a second major in sustainability. These are examples of positive development in Singapore. But to ensure that graduates are well equipped to meet the demands of the times, all such courses must go through sufficient policy and industry validation. For instance, Institute of Higher Learning should, if they have not done so, internalize the SkillsFuture reports to assess SkillsFuture needs in these areas and assess what skill sets they have to teach undergrads and graduate students. We should also encourage our course providers to ensure that all courses provide adequate time, emphasis, and coverage on Singapore so that students can really understand how to green Singapore and the challenges that Singapore faces. Do knowledge providers have the right people to teach and impart such knowledge and skills? How do we ensure this? Some form of impact assessment is necessary to track lifelong learners' progress, comprehension, and application. Second, knowledge and content providers across the institutes of higher learning also need to be given adequate support to do this important work of providing the knowledge and skills for the workforce. Hiring practices at university need to reflect contribution to society beyond traditional publication and impact factors. If Singapore is to succeed in our green transition, more emphasis needs to be placed on hiring experts that have real-world experience in solving complex sustainability challenges. Demand is also growing for Singapore to help build regional and international capacity. Overall, there is growing demand for Singapore's experts to be ready and available to impart valuable knowledge. To do so, we need more Singaporeans to step forward with the right knowledge, skills, and attitude to help grow our local, regional, and international sustainability talent. Indeed, we need to actively grow our pool of educators. Climate change demands urgent action from everyone across all sectors of society. As we focus on upskilling and capacity building of workers, we must also not overlook the support and training we need to give our educators. We need to grow our pool of sustainability educators, and we need to do so fast in this quick journey of manpower transition so that we do not lag behind our 2030 and 2050 goals. Mr. Deputy Speaker, in closing, I look forward to the replies to the concerns I have raised. Thank you.